Telling is persons with disabilities at Okaishie Drugs Lane in Accra have benefited from a free medical screening organized by the Women's Ministry of the Adabraka District of the Church of Pentecost in partnership with ATF Diagnostic Center. The beneficiaries had their national health insurance renewed. The outreach, which forms part of the church's social responsibility, seeks to improve access to health care for the vulnerable, while curbing the high number of persons with disabilities who are often left without proper medical attention.
2021 population and housing census, about 8% of Ghana's population, representing more than 2.4 million people, live with some form of disability. Common challenges include limited access to health care, unemployment rates nearly twice the national average, lack of inclusive infrastructure, and widespread stigma. As part of the outreach, participants were screened for vital signs, blood pressure, blood sugar levels, malaria, hepatitis B, and others. The exercise also supported beneficiaries with National Health Insurance Scheme registration and renewals, ensuring they can continue to access affordable care. Adabraka District Pastor of the Church of Pentecost, Pastor Emmanuel Osei commended the collaboration between the church, women's ministry, and health professionals, stressing that persons with disabilities must be empowered to use their God-given abilities and not be confined to street begging.
So we want to encourage them that though they are disabled, they have some form of disabilities, they need to encourage themselves, they need to serve the Lord, they need to work on their salvation, and also not be used in the streets to be begging for alms and other things. Because the little empowerment that we give them, they should take advantage of it and come out with something, develop whatever is inside of them.
National Coordinator for the Ministry to Persons with Disabilities, Pastor Alexander Nyame, called for greater national commitment to tackling neglect, discrimination, and stigma. He urged institutions to provide equal opportunities for employment and empowerment.
How many organizations, how many companies employ persons with disabilities? And when they employ them, to the resources, to the tools they will need to work are not available. And so how are they supposed to survive? And so that is what forces them to the streets. And so if we want to solve this issue, it has to be first commitment. We all commit to that agenda, and then we put down the structures and ensure that whoever deserves what is given what he or she is deserved.
District Women's Leader Deaconess Mrs. Patience Abankwa noted that the initiative demonstrates the church's practical commitment to serving the marginalized.
We are doing this so that they will know their health status, and those that need further attention, we advise them to do that.
The church and its partners distributed medications, food